This is Dr. Monji here with Jaylee, my office manager, and we're going to talk a little bit about microcurrent. We do a lot of this in our office. And Jaylee, so what kind of condition do you have going on with your foot here?
Yeah, so I have plantar fasciitis.
Okay,
Yeah.
so people have probably heard about plantar fasciitis. What happens is, for some reason, either it's coming just from the foot or when the hips are maybe out, what happens is the arch often drops and it puts tension on the tendons at the front of the heel and cause a lot of kind of heel pain, and also sometimes into the arch, the bottom of the foot. And so those tissues, the tendons at the bottom of the foot are kind of stretched and puts a lot of tension. It can create a lot of pain, and sometimes it can create a little bone spur on the front of the heel as well. So what does the pain feel like in plantar fasciitis, or for you?
For me, it is just aching.
Achy?
Yeah.
And where does it ache?
It aches in my heel and then up the arch, but it'll also ache on the side of my foot and into my ankle.
Okay. And so some of the things I do to help, first I want to make sure that the alignment of the hips, because a lot of time it's coming from the foot strike, the foot hitting the ground unevenly. So it can be coming from the hips, but then it also can be coming from misalignment in the foot itself, and actually a lot of different conditions. We're just discussing, sometimes people can maybe even have emotions relating to it, and so that's not a stretch of the imagination. So you always want to make sure structurally how the body's doing. And then so this treatment's called, the full name's called frequency specific microcurrent, and we just call it microcurrent or microcurrents. And so what it is this came out in about a lot of doctors of osteopaths used to use it a lot, 1910s, 20s, and then it kind of went underground. The American Medical Association said they weren't helping people, kind of outlawed it, and then it kind of resurfaced in about the 1980s. Actually, a chiropractor kind of bought a practice that had some of these old machines, and she kind of revived it, Dr. McMakin. And so we use it a lot for different things. And so how it works is there's a there's an A channel and a B channel, and the A channel is for the condition. So for plantar fasciitis, what we're doing is we treating her for inflammation in the tendons, in the ligaments, the fascia, a bit of the arteries. Let's see what else. Joint capsule. And so we can, and with microcurrent, you can treat any part of the body for different things. And so this is more like a joint pain, muscle pain, tissue pain, but we also sometimes even use it for emotions. But so what have you noticed differences when we do these treatments?
Yeah, so when we did it yesterday, I noticed immediate, like my foot had ached all day. My foot into my ankle and even into my knee was starting to ache. But after we did it yesterday, I noticed the aching went away. As the night went on, it kind of started to ache again, just from being up on it and stuff.
Yeah.
But
so I think this helps a lot of inflammation. So we have so how the microcurrent works is each tissue has a frequency, and so every part of body. So for example, let me get my other list out here. So we have a list of kind of body tissues, and so for example, we talked about the muscles, tendons, ligaments, but even like sometimes I'll treat lungs, trachea, things like that. And so every tissue has a frequency, and then we can treat it for a different type of a condition, like acute inflammation, chronic inflammation, scarring, increasing secretion. So this is kind of our a la carte menu, and we can make up protocols. We've already got some made up protocols just to go over a lot of the common ones. We've done some peripheral neuropathy for people that have diabetes, blood circulations. We've tried shingles. That was a tough one. Let's see what we use a lot of. Quiet adrenals, help stimulate the adrenals.
Concussions.
Yeah, concussion we do a lot. It's called the concussion and nervous system trauma. We do a lot for what? Headaches, brain fog, even sometimes allergies. Just settle down the nervous system. Yeah, we got one for myofascial pain. disc pain, more facet pain. That's more the joints in the spine. This one, this protocol, we call it kind of BLT, the bursa ligament and tendon. And so this is really good for any joints, sprain, strains. Like if someone sprained the ankle, we may do this. Or we've also got one for new tissue,
like a brand new injury.
Yeah, brand new soft tissue injury. That's really good. And with microcurrent, if you can get it on like within the first 48 hours, it really decreases the inflammation, because a lot of the time it's the inflammation that actually expands the tissues and stretches and does some of the damage. So that's why it's great to get microcurrent on. Also ice and compression for any new injury. Let's see, what other conditions or things do we use the microcurrent for?
Well, like you said, emotions. I think the emotions are a big one.
Yeah. And so we found that parts of the brain that tend to be, I guess, the trapped negative emotions settle there, and so we can treat emotions with this. And so we put, on that case, we put the towels. We put one at the back of the head, one in the forehead, and so it's running parts of the brain. And by the way, this is really safe. It's battery powered, as Jaylee found out. The other day, what did you do?
Well, the cord got stuck on my foot, and I pulled it down.
Yeah, the whole machine fell, and she picked it up and heard what? Rattling?
I heard rattling, and I thought I broke the whole machine.
But it's a battery, so there's like about 8 or something D batteries, and so it's just battery powered, so it's real safe. So we can do it. A lot of people. When can't we do microcurrent?
If they're pregnant, or if they have an electrical device like a pacemaker or a defibrillator or something.
Yeah, because it may affect the frequencies or how the electronic device works. So pacemaker, defibrillator, also pregnancy. It's just like a liability issue. So a lot of the time it won't affect it, but we don't want to take any chances. Yep. Okay, and so we use this a lot on a lot of patients. Sometimes we use the emotional stuff just to calm down the nervous system. Someone had a traumatic event and she's like, I just need to calm down. So we do the concussion protocol on the nervous system just to settle it down. I've done it on emotions. I think when my brother passed away, I did emotional clearing, and I did some of this. And so you can use it for like musculoskeletal pain problems, also organs. Sometimes we do it on digestion. So it's really valuable. So
I noticed it helped Bridger's asthma a lot too.
Okay, yeah. So asthma. Obviously, we change where the location of the leads. That would be around the lungs. Let's see, what else have I done? When I first used this, this is like a manual one. Oh, we've got to change that.
Change it.
Okay, so what we do is we actually change the frequencies. We're going to change. That was ligaments. Now we're going to do tendons, I think. Yeah. And so I just manually change it. Then, what was I talking about?
We're talking about the location.
Yeah, but I can't remember what I was talking about. Anyway.
Sorry.
But I've treated myself with it. Oh yeah, when I first had this in practice, I used to practice in Vegas, and there are also different types of machines. There's more automatic ones, which we'd love to get again, where you don't have to manually change it, but it's set on different protocols and it just runs. You just press start, and I had a bad headache, and I went home and I'm like, oh, I've got the machine, let me use that. And so I put it on my head, and I was manually changing the protocols, and I had a big thumping headache, and I fell asleep, and I woke up and the headache was gone. The machine was still on me. It's funny. But then I developed a test me of how this can help headaches. Almost like a migraine, like a tension type headache. So that's one kind of service that we offer in the practice. And any other things about microcurrent that you can think of? I don't know. Yeah, we just use it as we do it along with other things like chiropractic. We do a lot of functional medicine, and sometimes we're doing, we have a biofeedback machine in the other room to like reset the energy of the organs. But then we're also sometimes doing this. Sometimes this works a little stronger than the other machines, but we really love it. So
I think it's just important to know too that it's probably not going to be a one-time quick fix type thing.
Yeah. So
it's going to take consistency.
It's funny. So you had your plantar fasciitis on the other side.
Yes.
And then we helped that, and we used also shockwave therapy, which is another one, using sound waves to help the plantar fasciitis, and then it kind of switched to this,
Mm-hmm.
which was interesting. And now it's kind of getting better, and then we're still trying to get that 100%. But health is sometimes a process. Sometimes it takes a while, and you got to be patient with things.
Mm-hmm.
There isn't always a quick fix and a band-aid.
Yeah.
So all right, so that's uh, Dr. Monji and Jaylee from Balanced Health. This is a little bit about microcurrent, or the full name is frequency specific microcurrent. Okay.